time and your attention today. I think all of us have been enlightened by the nature of your comments, and you've been fairly transparent when you haven't known what's in the bill. I appreciate someone saying, I have no idea what's in the bill. And I do think that this season that we're in is absolutely incredible. There is momentum here, right? And there's an opportunity, I think, to do something transformational. But it has struck me as strange that here we started this hearing at 9 o'clock, and I was out for a couple of minutes for some of the procedural stuff that's happening on the floor, but we're well into this hearing, and we haven't had much of a conversation about Medicare fraud, about fraud within the system and abuse within the system. I've been briefed by experts, and I don't think these are folks that are pulling punches one way or the other in terms of donkeys and elephants, but have come to the conclusion that as much as 13% of current Medicare outlays are fraudulent. I've got a quote from the Chief Counsel to the Health and Human Services Inspector General who said, building a Medicare fraud scam is far safer than dealing in crack or dealing in stolen cars, and it's far more lucrative. And here we are on the verge of something that is absolutely enormous in terms of cost. I mean, frankly, when cost comes up, the majority kind of loses eye contact and gets a little bit defensive, with all due respect, about, well, who's putting these estimates out and so forth. But as we're sitting here today, no real number in terms of a cost estimate. And yet, here we have this opportunity to recast resources and put it in the proper direction that I think is ultimately can have a huge impact. So I'd like to shift the conversation a little bit. Dr. Holohan, something that you said concerned me, and I want to give you a chance to clean it up. But when you were having a conversation, I think it was with Mr. Nunes a minute ago, and in sort of defense of Medicaid, you said, and I jotted it down because it really got my attention, you said, and these were attributes that I interpreted as positive attributes, right? You said that it's big, it has a history, and it has lots of, and I'm sort of putting that in, law and regulation around it, meaning sort of this case law around it. And I would suggest that I think that's one of the real weaknesses of the current system, that it has become hidebound, an inability to recognize fraud within the system, an inability to recognize abuse within the system, an inability to recognize overutilization and so forth. And I just wanted to, first of all, give you an opportunity to surely those three adjectives of big, rich history and lots of law and regulation isn't an attribute. Those aren't characteristics that you're lauding, are they?
Well, what I meant was, to be more specific, I think that this is a really big deal to reform our health system. To the extent you have something that you can build upon that works reasonably well, despite some problems, I think that is a good thing when we're taking on so much. A few years back, I did a study with a colleague of mine to look at, is Medicaid really a high cost relative to private insurers? So we compared Medicaid to people with private coverage, all low-income people, and looked at whether medical benefits, when you control for health status and income, education, and other characteristics, and control statistically for that, and Medicaid, turns out, is less costly. And that is not to say there is not fraud in Medicaid and Medicare, but despite that, it is less expensive than private insurance by some margin. And we certainly should go after fraud wherever we can. I guess the thing I'd be curious about is whether the same study that you were referring to had anything to say about fraud in Aetna or Blue Cross plans or anything like that. I mean, I don't know whether it did or not, but I can't believe it's totally absent in those.
Yeah, look, there's no question about it. But I think here we are 3 hours into a hearing that by the proponent's own adjectives is going to transform the system, and yet we really haven't had much of a conversation as it relates to driving just rampant abuse out of the system. And thank you for being transparent about that. The people that I've interacted with as it relates to Medicaid, feel underserved by it, feel discouraged by it, and it's taken the joy of the medical practice from physicians. My time has expired, and I yield back.